好，欢迎大家到我们中间来到这一个很特别的讲座。我今天特别的，真的很感谢神，我们能够请到很有经验的陈长宁Dr. Daniel Tan 来到我们的中间。在开始之前，让我自我介绍一下，我的名字是 Lily Lam 吕林华我先生姓林。我是这个早生辅导中心的主任，所以在这里呢。特别欢迎大家能够来到这一个讲座。在我们开始之前呢，我特别要谢谢 Hope Foundation， 因为是他们特别关注我们亚裔的那个精神状况，也在那个制作我们一连串的很多的不同的关于我们青少年精神病患或者精神健康这方面的讲座。也特别谢谢光颜社他们在与 Hope Foundation 这个合作之下，带领了很多的教会跟不同的中心来参与这一个的一连串的这些的教育的讲座。也在这里也有福篇中国教会辅导中心跟我们一同来合办这一期的青少年讲座系列。以下呢，我们其实有一连串的讲座在这里特别提醒大家，下个月10月3号我们还有另外一个，这一个是一个很特别的讲座，我们没有请什么特别的讲员，我们是录影了，访问了一些的家庭，他们的孩子有这个精神病患，母亲是怎么样的支持照顾，走过这个风雨。而且呢，也有青少年他们自己现身的说法，他们是怎么样去面对他们的在这个有精神病患的挣扎当中。所以希望大家来参与，之后我们可能有多一点的讨论，大家可以分享你们的风雨之路。可是我们相信都在神里面，我们都会看到神的应许，看到神的彩虹。所以希望大家特别留意10月3号我们有这个讲座，也是星期六早上10点钟。在我介绍陈教授、陈医生之前呢，我想大家等一下肯定会有很多的问题想跟陈医生来问因为陈医生是很有经验，而且呢他的 appointment time 很多时候是3个月所以我们特别高兴今天他在我们当中。所以如果你有问题的话，你可以用中文、英文都可以把你的问题呢用 chat 打进来，然后呢，我可以把你们的问题呢用英语跟陈医生来交流，他的回答也会在用英语，可是需要的话，我们也可以简单的来翻译一下。在每一期讲座以后呢，很多的观众参与的弟兄姐妹朋友呢，他们都会说我很希望有那个 PowerPoint， 所以如果你需要的 PowerPoint 的话，请你用 Chat 把你的 email 打进来，然后我们会把一个比较详细的一个 evaluation form 寄给你，你填好了，我们会把 PowerPoint 寄给你。可是等一下在问问题的时候呢，我们有个很简单的 poll 4个问题你们只差我想30秒就可以回答，因为我们也应该就是把这一次我们参与的一些的反应告诉那个 Hope Foundation， 让他们也看到他们的投资在亚裔当中是非常对我们的这个社区很有帮助。好，如果大家没有问题，往下呢，我要来介绍一下Dr. Daniel Tan 陈长宁医生我很高兴认识他已经很多年。我们特别有很多时候呢，有我的 client 有需要的时候，特别能够请到他参与帮忙。陈医生是在新加坡的华人，他的家在新加坡、马来西亚那边已经有6代以上的历史然后他来美国，他毕业于 Oral Roberts 的大学，在那个 Tulsa 的医学院。他拿到医学degree 以后呢，他来到 Houston Baylor 我们很出名的 Baylor 呢，也是做那个 fellowship 主修 精神科、儿童科跟青少年精神科这方面的研究跟实习fellowship。他在这个经验呢，已经有25年以上的一个经验哈。他现在呢在 Houston 是一个 Medical Director of Children's Service at West Oak Hospital。他也是 UTMD Anderson Cancer Center 的儿童部的顾问 consultant。他的研究跟兴趣专注于那个 ADHD 注意力不足的过度症，也是他的专长。他也真的很有爱心，特别服务于那个 foster children 这寄养的孩子方面。陈医生已经结婚，有一个很能干帮助他的太太，还有一个孩子好像已经要去念大学了。他每天的工作很繁忙，我去过他的诊所，可是他说他感觉到今天他每天支取的能力是从他相信的神，而且他每天读神的话语跟祷告里面给他力量，所以我们真的很感谢神在 Houston 有一个那么有爱心，也是很愿意帮助我们华人服务有需要的青少年。所以我不占太多大家的时间，我现在把时间交给陈医生 Dr. Daniel Tan。 Okay, time for you, Dr. Daniel Tan.
Okay, thank you. Let's I'm going to go back to sharing the screen now. Can everybody see the screen?
Yes.
Good.
Yeah, I can see the screen.
Very good. So welcome to everyone, and thank you, Mrs. Lily Lam and Mrs. Tina C for helping me and inviting me to come and share some information with you. And before we start, let's have a quick word of prayer. Father God, we just come to you to thank you and praise you for this opportunity to share and to learn about mental illness in children. And Lord, I pray that you will bless our time so that we will all learn from our experiences, learn from knowledge and in the slides that are going to be presented, and that in the end we will be better able to deal with issues that may come our way. So we thank you and we praise you in Jesus' name. Yeah. So as you know, thank you all for coming. Today we're going to look at how to recognize mental illness in children, and also talk a little bit about parenting in general. And I'm also going to give you a quick Sunday school lesson just for good measure. So without further ado, let's move on to the next slide. And okay, from Proverbs 22.6, Proverbs 22 verse 6, it says, start children off on the way they should go, and even when they are old, they will not turn from it. This is actually a very important verse because we find that in childhood development, the first 5 years of a child's life are the most impressionable. In fact, the Catholic Church even says, if you don't teach a child about the Lord before the age of 5, the world can have them. So that just shows that how important it is for us to share the gospel, share the love of Jesus Christ to children, not just our own children, but children that we know, that we come into contact with about the Lord. Very, very important. Let's move on to the next slide. This is a quote from a very famous author, Mark Twain, who wrote, and I quote, "When I was 14, my father was so ignorant, I could hardly stand to have the old man around. But when I got to be 21, I was astonished by how much the older man had learned in 7 years. So, again, this is an important time that we're talking about in the life of a child. We're talking about mental illness in teenagers and in adolescents. We'll actually look at the issue of mental illness in children as well, but just to let you know how much changes in the years of a child and a teenager during this time of their life. So let me give you a few tips about the role of Christian parents. Many of you who are in the audience today, some of it is probably just common sense and something that you know well, but let me just go through them fairly quickly. One, I think it's incredibly important to pray with and for your children. That's one thing. Secondly, create a routine for daily devotion, if at all possible, and and then maintain that from very young. You will find that it will be a discipline that a child will carry through, even through adolescence. My 12th grader, even up to now, even though he never listens to me very much anymore, when it comes to our daily devotions at night, he will still cooperate and we will read the Bible and pray together. Emphasize the story of the cross. You know, many times there are so many stories in the Bible, so many parts, and people say, what can I do? What should we talk about? Well, my feeling is the story of the cross is really important. And I will show some aspects of it that I think are clear and important, because it's a story of love, it's a story of sacrifice, and it's a story that encompasses so many themes about the family. Live by example as best you can, especially prayer. We're all sinners, and it's always very difficult to, that's why we always tell our children, do as I say, don't do as I do. But if at all possible, the parent who strives for righteousness and lives to serve the Lord, that's probably the best example of how best you can be and how best you can show your children how to live. When it comes to love and devotion and hierarchy, I like this little thing which shows that you put God first, then you put your spouse second, then your children third, then your work and career fourth, and then fifth, the church. This should always be the hierarchy. And this has been something that's helped me in my own life as well. Break the bondage of generational sin. As you know, many of us may have come from families that were not Christian, and many of us may have come from a different country where we were involved in worship of a different religion and so forth. And many times those types of sins carry on and into the next generation. And so it's important once we become Christian and practice Christianity that those bonds from the past are broken. Learn to pray for wisdom. I have learned in my life that we face trials and struggles of different kinds all the time, but and God doesn't God doesn't protect us from a lot of these trials. A Christian is not protected from trials and tribulations. We live in a sinful world and an imperfect world. But James 1:5 says, if anyone lacks wisdom, ask it from God and he will give it to you freely. And so that's one thing that I find is what the Bible promises and what we can hold true to. And finally, trust in the Lord, but not your teen. And I will expand on that particular theme as we move along. Be vigilant about your teenager. Trust in the Lord, but do not trust in him solely. And these were just some aspects of the cross, the story of the cross. It's a story of love. It's a story of sacrifice, pain and suffering, obedience. It is the only way we will know the Lord. It is a story of forgiveness, salvation, the promise of eternal life, and so many other things. A father's sacrifice. It's the story of a son's obedience. It's a story of humility. I like to tell a lot of teenagers and children, you know, many times when we see Jesus on the cross through a painting or an illustration, frequently it's got him dressed in a loincloth. In other words, he's got some type of covering that covers his privates. But history, a lot of the historical scholars will tell you when Jesus was crucified, most likely he was crucified naked. And a lot of children, it will ring true to them because children, especially adolescents, become very, what's the word, very self-conscious of themselves. So when you talk about something like this, they fully understand, and so forth. So these are themes that come from that just one story. Let's move on. So now we're going to move to a different topic, and we're going to talk about parenting. The question here is, what type of parent are you? So right now, I show 4 different red squares here depicting certain types of moms. Some of you already know where I'm going, but it talks about the different parenting styles and how we look at things. I can tell you right from the bat that the tiger mom is more like the Asian mom, and the helicopter mom, the lighthouse, the parent, and the lawnmower, snow plow, and bulldozer parents are more like Western parents. So the tiger mom is someone that unfortunately is frequently hypercritical, has very high standards, can be rather demanding, and he or she, the tiger parent, expects children to learn from their mistakes and become resilient. So that's the tiger mom, the Asian mom. The helicopter mom, which is more frequently the Western parent, they have a tendency to sort of hover above to protect their kids. And that these kids frequently are kids that can do no wrong, and they focus more on issues of self-esteem and success. Then you have the lawnmower, the snowplow, the bulldozer. These are parents who remove obstacles by clearing a path to ensure success and prevent their children from experiencing failure. I suppose a good modern day illustration would be those parents who, some of whom have been convicted and now in jail, who have, and there were some high profile ones recently, where they have bought their child's place at a prestigious university. Those would be the lawnmower parents, the snowplow parents, the bulldozer parents. And then finally, the lighthouse parents. These are parents that tend to be a little bit more passive. They're not as hands-on, they're not as assertive, and they provide what they call a stable light or a beacon from the shoreline. So they they're sort of parenting from a little bit of a distance. I guess the most important thing to take home from this issue is that none are ideal. And it's up to us as a parent to choose what suits our child the most. And just remember that not all kids are the same. Then these are just other types of parenting styles that I've included here: the indulgent parent, the disciplinarian, the permissive parent, the one who allows everything, the uninvolved parent. Unfortunately, we know of lots of fathers who may be very successful in their careers or successful in business, but they're the ones who are workaholics and don't spend enough time with their children. Then you have the authoritarian type of parent, as well as the overprotective parent. So what are the challenges in parenting? I'm just going to go through these somewhat quickly. Firstly, I'd like to say parenting is a sacrifice. There's no place for selfishness in parenting. And yet, I think for most of us, we are all inherently, unfortunately, selfish people, because we are sinful and we're a broken people. Secondly, parenting is like catching a fish. So just think of yourself with a rod and reel and fishing off a pier or something like that. As you know, it's difficult. If you get a bite, if you reel in the line too quickly, it might be strained, and then it will snap, and then the fish will get away. On the other hand, if you give it too much line, it might also get away. So parenting is difficult. It's a challenge. We've already talked about how much involvement is the right amount. That depends on your own personality, as well as your child's needs and their type of personality. Number 4 here, it's wanting to be liked by your kids. I like to share the story of my in-laws. My mother-in-law, when my son was very young, we would leave him there for the afternoon or for the day, and she would be very concerned about the child liking her. And so sometimes we would come at the end of the day and pick him up, and we'll ask, well, did you have lunch? And she would say, no, he didn't have lunch. Why didn't he have lunch? Well, he said he wasn't hungry. Or did he take a nap? No, he didn't take a nap. Why didn't he take a nap? Well, he said he wasn't sleepy. Sometimes you just have to be the parent, and they have to eat and they have to take a nap. And sometimes I think she was concerned that if she forced him to do too many things, he might not like her. But sometimes, as parents, we're the parent. We're not their friend. Sometimes we worry about the wrong things. Going on to the next line, teenagers may have problems, but frequently they are not the problem. I love to say this many times to parents, because unfortunately, there are situations when we are the problem. We as parents are the problem, not the kids themselves. The second box here on the second line, it says here, need to hear with our eyes and see with our ears. We need to be vigilant. We need to know what's going on with our children, especially with teenagers, especially with what is happening in our world today, especially with technology, cell phones, iPads, and so forth. These types of things make our children incredibly vulnerable. And so we have to be very aware of what they see, what they do, what they're playing, that sort of thing. Moving on to the next purple square, it says here, the apple does not fall far from the tree. just remember, our children are very much like us. They learn and see how we deal with things, and that's how they deal with things as well. So I like this particular saying where it says, the apple does not fall from the tree. And in a similar light, the next blue box, it says, monkey see, monkey do. Never say never, but how we deal with things, how we deal with life, how we deal with life crises and stress, what we say. Children are like sponges. They see and hear everything we do. We've already talked about parenting styles. Too protective is no good. Too permissive is no good. So the important thing is to always strike a balance. And sometimes that's difficult. And that may have to change as a child ages. We've already talked about the need to be vigilant. Children also need the opportunity to learn from their mistakes. Again, the previous slide about the lawnmower parent or the overprotective parent speaks of this particular issue. Our children need a course in hardship. I think in this day and age, we protect our children too much, and just the way they live, you know, they've many times I'm fearful that they have not been given a chance to truly suffer something. And so I always say we should try and figure in some type of hardship course in their curriculum of life. Otherwise, you know, it doesn't help. Frequently, we need to put ourselves in a position of strength. If we're running thin, if we ourselves are too stressed, if we are too anxious, or if we're depressed and we don't take care of ourselves, then our effectiveness and ability to parent effectively is compromised. We are not the best we are for our children. And finally, I think I've alluded to this before, we need to be a parent and not a friend. Okay. Moving on, let's touch briefly about the need for greater understanding in Asian parents. Firstly, generational issues. This actually can mean many things. Sometimes we might be in homes where there are 3 generations, and especially if it is a family that's come from a different country, you know, having 3 generations may be helpful, but can be a problem as well. And I think for many of us, we're probably aware of what those issues are. So it may not be an issue, but I've heard of extreme cases where this has been an issue. Many years ago, I had heard of an Asian family, a well-to-do family that had constructed a home, a very big home, for a 3-generational family, where there were 3 floors. The top floor of this home, this mansion, was occupied by the grandparents, and they sort of held court at the top floor. Then in the middle floor, you had the 2 grown-up sons who had families of their own. Number 1 son and number 2 son. They had their separate areas, but they were sort of on the 2nd floor. And then on the ground floor, you had all the public rooms, the dining and all that sort of thing. And they were rich enough to be able to build this sort of thing. But as time went on, there began to be some problems and cracks where the wives of the sons became stifled or frustrated because of the control that the grandparents had over the sons, over their husbands. And then the younger children started to have problems with rebellion and so forth. And it was not only after one of the daughters-in-law decided to move out of the home did this whole problem be resolved. So it's a big issue, and something that is somewhat unique to Asian parents. Cross-cultural issues. As you know, our children, especially for us as parents who grew up in a different culture, they have to assimilate, they have to acculturate, they have to, they are part American and part Chinese, they are part new country and part old country, and sometimes that's difficult, and sometimes more difficult, sometimes more difficult with parents who have not acculturated, and parents and families who have not been able to sort of integrate into American culture. That adds to the problem. Now, identity issues. We don't have a lot of time to address this particular issue, but for adolescents, for teenagers, their developmental task in life is to figure out who they are. Remember, a teenager and adolescent is half child, half adult. And so they're at that stage where they're beginning to sort of figure out who they are. And that includes cross-cultural issues. Are they Chinese? Are they Asian? Are they American? I find that fascinating. Even in my 12th grader, my wife was born in the US, even though she's Chinese and I'm from Singapore, but I lived in a more westernized family than some who may have come from China or Taiwan or somewhere like that. But my 12th grader, he has sort of graduated or migrated towards the Asian boys, the ones who are a little bit nerdy, ones who place a high emphasis on academics and so forth. And he has sort of slowly built his own identity. I would have thought growing up here, coming from more sort of assimilated parents, that he would be more, he would lean towards more being somewhat more American, but that's not the case. Moving on, communication issues. We are terrible at listening and hearing what our children's needs are. So that is something that we have to work on all the time. Looking for problems in the wrong area. Sometimes we worry about things that we don't have to worry about, and that can be a problem. Just remember, teenagers need outlets to express themselves. So it's important for them to have different kinds of friends, friends from a similar church, but friends from school, that sort of thing. And teenagers, as I said before, need friends. There are other issues that they deal with that we have to be aware of, and that is peer pressure. Many times there may be a need for a child, especially a child who doesn't have very good self-esteem, to want to fit in, to want to fit into the culture, to want to fit into their friends at school and not be left out, and not be, to want to be included and not be left out. And that sometimes can cause problems. And then associated with that issue, the lack of self-confidence. And finally, this is a big one for us as Asians, as Chinese families, the fear of failure, the whole issue of shame and disappointment. It's good in some ways, but it's also bad in some ways. The good is it propels us, it compels us to want to succeed in life and not fail. But at the same time, it may make us also, or make our children be less assertive in in their own lives and not be as happy-go-lucky as they could be. So let's move on now. We've talked about parenting, parenting skills and how we cope with stress and that sort of thing. Now we're moving on into identifying mental illness in children and teens. And unfortunately, it's not easy. A good way to look at things and to be better able to identify things is to know the causes and the risks. And I will illustrate that point as we move along. Secondly, to know what to look for, because many times we don't know what to look for. 3, what are the risk factors? For instance, if you have a child that's in an environment where they're not exactly what our children might be going through, but if they're in a neighborhood where there's a lot of drugs, then know that, you know, there's a high likelihood that they might encounter people who may be a bad influence towards them. So you need to know what the risk factors are. And of course, the title of this lecture, know the difference between normal versus needing treatment. So let's look at the warning signs and symptoms. And these things change with age. So the next 3 slides will show us warning signs broken down by age groups. Firstly, we talk about preschool and early elementary. Then we talk about elementary and middle school. And then we talk about the teenage years, which are the high school years. So briefly, to look at the preschool and early elementary school years, these are some of the signs and symptoms to be aware of. 1, behavior problems in preschool or daycare. If a child, if the preschool teacher is calling you, or the daycare is saying, reporting behavioral problems like he's too aggressive or he hit another child, those things can be a key to something that might be going on that's not quite right with your child. Also, if they are hyperactive, way beyond what other kids are doing, that could be a problem. Trouble sleeping could be a problem. Persistent nightmares could be a problem. Excessive fear, worrying, and crying may be a problem. Extreme oppositionality and defiance, being aggressive, being impulsive, hitting other children, engaged in destructive play. You give them something and within a short period of time, they've destroyed that toy. Hurting peers or animals. These are all signs to be concerned about. Lots of temper tantrums all the time. Persistent difficulty separating from a parent. This would be the parent who may come and say, gosh, you know, I can't leave my child in school. He will yell and scream, and then the parent may have to ask someone from the school or the classroom to come out to the car to help the child out of the car and escort him into the school. You know, those types of things. Moving on. Grade school years. Big change in friendships or relationships, where they had some friends, now they've gravitated to a different kind of friends. Friends that wear black, paint their fingernails black, that kind of thing. Have excessive fears and worries about life. Extreme hyperactivity. A sudden drop in grades, a sudden drop in school performance. Loss of interest in friends or favorite activities. Loss of appetite. Sudden changes in weight. Excessive worry about weight gain. Sudden changes in sleep habits. Visible, prolonged sadness, seeing or hearing things that are not there. So these are, you know, and it doesn't mean that you have to have all these things. Frequently, 2 or 3 will sort of lead us to suspect something might be going on. And then finally, in the tween and teen years, all of the above symptoms that I've talked about, plus the following. 1, destructive behavior, having tantrums and rages, damaging property, setting fires or hurting others, including pets, constant threats to run away or have run away, withdrawal from family and friends. They become a lot more withdrawn, just want to stay in their room, isolate, that kind of thing. And you're unable to tear them away from video gaming or electronics. Not a child that, now it's important to understand the severity of this issue. Not the child that's playing on the cell phone, because they all play on their cell phone all the time, but a child that becomes unglued when you say, give me your cell phone, you know, and becomes extremely reactive because of that. Comments or writings that suggest that there's desire to harm self or others. Now this, all this is suggestive. It might be important to know, but you don't want to read too much into this, because sometimes children use writing, or we call it journaling, as a way to express their feelings. And even though sometimes the theme of what they're writing could be very negative, not always does it mean that they're depressed. So it's best to be aware of these signs, be aware of these efforts, but then at the same time, not be too alarmist about them. Self-injurious behaviors, that's always a warning sign. Now, self-injurious behaviors or self-harm or self-mutilation is different than being suicidal. Self-injurious behaviors are a maladaptive coping skill. In other words, many children will tell you, gosh, I cut myself because physical pain is easier to accept than emotional pain. So they may be talking about some type of emotional pain, maybe the loss of a loved one or something like that. And that loss, that emotional pain may be so hard to deal with that cutting themselves, physical pain, is easier to cope with. At any rate, self-injurious behaviors are not good. They're maladaptive coping skills, but they do occur, and frequently they're more benign than they are truly dangerous. Other acting out behaviors, lying, stealing, using credit cards, those are all also warning signs of problems in a teenager. And then of course, never forget the possibility of substance use or substance abuse. So many times when parents say they did not know or had no clue, unfortunately, as I've mentioned before, frequently they were not vigilant. They were not involved in their kids' lives. They took things for granted. They were not monitoring things carefully enough. They may have had their own agenda, or they were too self-absorbed in their careers or in their profession or whatever. And sometimes truly they just don't have a clue. And I'm not sure what is worse, not having a clue or having a clue and just not looking at it carefully. They did not know what to look for. They were too involved in their own lives, as I mentioned, didn't want to see the obvious. Sometimes they don't want to see the obvious. And then the last thing, of course, is this thing that the mians, you know, didn't want to lose face, don't want to be embarrassed or embarrass their child, that kind of thing. So now when we talk about the causes of mental illness, it's important to divide it into environmental causes and genetic causes. Let's look at some of the environmental causes. First thing, life losses. This is very, very significant. Any child who loses a parent at a young age, that child becomes very vulnerable to problems, especially depression. Death of a parent, even multiple moves. I had a family one time, two boys. Now this was an American family where the father was an executive in a company, and he was so successful that every year during when the children were in elementary school, every summer he got promoted, and when he got promoted, they had to move to a different city. One of the sons actually told me that for the 6 or 7 years of elementary school, they were never in one elementary school for more than a year. So they were, and they moved, and the mother said, we didn't think that was a problem because they always did well. Well, the children were smart, so academically they did well. And unfortunately, because they were smart and they did well academically, it masked a lot of the problems that they had. And that was each time they made friends in a particular grade, before they had an opportunity to maintain those friendships, they had to move to another school or to another city. Then they had to make new friends. And then they had these friends for only a few months, and then they would move again. And those were multiple losses. Parental divorce is a huge loss. I don't want to minimize that issue. Death of a loved one or a pet. And in my population, especially the children that the CPS children, the foster children, a lot of times the parents are incarcerated. And so that is a loss for those parents. Let me give you some examples of the death of a parent. I have a cousin who was 11 when he lost his mother. This was my aunt, my maternal aunt, my mother's second sister. She died of a stroke when she was 48. My cousin was the youngest of 5 children, and he was about 11 years old when he lost his mom. And even though he was smart and successful and went on and did well and became a lawyer and so forth, unfortunately, he has suffered from depression for a good part of his life, and that depression actually worsened during his adult life. So I strongly believe it was because he lost his mother at a young age. So even though someone can cope, that it still takes a toll, and unfortunately, these children pay the price for that. Prince Harry, the British royal family. That's another interesting story. Some of you who like the tabloids or read People magazine and so forth, you like to follow what's going on. Of course, Prince Harry married Meghan Markle, and the thought when they got married was that they would be part of the royal family and so forth. Of course, he's made that huge move to leave the royal family, renounce his royal title, and move to, I believe he's in the States somewhere in Los Angeles or something like that. Why would he do something like that? Now, he says that it's to protect his family, to protect his wife. And that may be true. But really, when you look at the poor child or the poor his history, he lost his mother when he was 12. And if you read some of his life stories, he will say that he believes that it was the paparazzi, those news hounds that killed his mother. And when they started being mean to Meghan Markle, he felt a need to be protective. And he did that. And he made these drastic moves, life moves, in the service of protecting his wife, which was a good thing. But I believe that a good part of all that decision was because he had lost his mother at 12 and had believed that it was the paparazzi that killed her. Next part here, abandonment and rejection within the context of the family. Again, it's related to life losses. Children who lose a parent feel abandoned and rejected. And it's a huge loss, and it is something that they carry throughout their lives. This is something that I hold true from my training days, because I had a professor one time that said, of all the trauma, of all the abuse that can be heaped on a child, nothing is as bad as abandonment and rejection. Emotional abuse, verbal abuse, physical abuse, sexual abuse, they're all bad, but nothing is as bad as the abuse of abandonment and rejection. And we've just talked about the issues of abuse. Sexual trauma. Sexual trauma is very complex, and we have no time to deal with all of that, but there are a couple of things that I do want to say about sexual trauma. One, depending on the child, it can cause a child to become eroticized. In other words, when a child is sexually abused, even at a young age, that child may, in that child's own limited way, be sexually aroused because of that. And that is a problem that may or may not carry him or her throughout the rest of their lives. Also, you will find that psychiatric disorders like depression and post-traumatic stress disorder are disorders that are frequently seen in individuals who have suffered sexual trauma. There are other problems associated with sexual trauma. The fear of revealing this and keeping it as a secret. The frustration of not being believed. I have quite a few foster children. One I have in the hospital right now, who tells me that she just wants peace in her family because her mother believes her, but her grandparents do not believe her. And because of that, the grandparents have chosen to discommunicate with this child because of what they feel she has brought to the family. She's brought shame to the family, and she has broken the family. And because of that, so these children suffer consequences of their sexual trauma. When they open up and they make their allegations and they break the family apart, frequently they are now not just traumatized sexually, but they are also rejected by their families. So lots of problems associated with that. One more thing about sexual trauma, a lot of them harbor a lot of anger because frequently the perpetrator is a family friend or someone close to the family. But then the big question is, how come my mom didn't know that this was going on? Why didn't she protect me? How come my dad didn't know that this was going on? How come he never protected me? So there's so many issues regarding sexual trauma. Exposure to pornography, I've already mentioned briefly. Many times, from teenagers downwards to grades, to middle school children, to even grade school children, when they're exposed, they see something that can be very interesting and enlightening, and not enlightening, not in a good way, stimulating, and that can have lasting problems. That's why I'm always fearful of that for all children, and because of how internet is these days, I believe it's a huge issue, especially, you know, the age at which children are now being given phones and smartphones is getting younger and younger. By the way, I have quite a few children who are much younger than me who have the latest iPhone, and I don't even have that. I believe I use an iPhone 7. My wife has an iPhone 6 or 7, you know, and they have their iPhone 11 or iPhone 10. It's amazing. And then the peer pressure issue. Sometimes if we're not aware of what's going on in our children's lives, this is something that can lead to problems. Exposure to substance abuse, either through peers, through the media, through TV, through the movies, that can be another issue. And many times it's not because the child wants to abuse substances, but they abuse it to self-medicate. In other words, they may have some other problem like a depression, and when they smoke marijuana or they try a drug, it relieves them from feeling a certain way, feeling a negative way, and that's how they get into substance abuse. And finally, the environmental causes of substance abuse or chemical dependency in the parents. This is what I say. When you have a parent who is alcoholic, when you have a parent who has a problem with drugs, that parent, despite how good that parent might be, that parent's ability to parent effectively is compromised. They are not able to be the best parents they can be because of their addiction, because of their alcoholism. Okay, so we've looked at what are the genetic causes of mental illness, and this is the psychiatric conditions that result from these genetic causes. And it's interesting to note there are many disorders that are that have what I say here, heavy genetic loading. In other words, it runs in families. It's unfortunately in the genes, and it's highly familial. ADHD is one. I personally believe that in my family, my father had ADHD. I had some level of ADHD. It skipped my younger brother, but his second son has ADHD. So it runs in families. Anxiety, autism, not so much. Schizophrenia, not so much. Depression, yes, big time. And bipolar disorder as well. In fact, if you look at certain closed communities in the US, for instance, the Amish communities in Pennsylvania, their prevalence for bipolar disorder is very high because there's a lot of intermarriage in their communities. So their incidence, their prevalence of bipolar disorder is very high. Chemical dependency is also an issue, big time. So unfortunately, that is a high risk for children whose parents have had problems with drugs or alcohol. So these are the major areas of mental illness, what we call the neurobehavioral disorders, such as ADHD or autism. Then the mood disorders like major depression, bipolar disorder, manic depression, or bipolar, it's the same thing. Anxiety disorders like generalized anxiety disorder, obsessive compulsive disorder, panic disorder, and also post-traumatic stress disorder. Those are the anxiety disorders. And then the thought disorders, schizophrenia, schizoaffective disorder, delusional disorders. These are patients who are paranoid and are psychotic. And then finally, substance abuse again. These are the major areas of mental illness that we see. So what are the common psychiatric disorders in children? I've already talked about the anxiety disorders. These are a persistent fear or worry and anxiety that starts sometimes at a young age and can go through their formal years of growth. Now, I haven't included this, but some anxiety disorders are mild, like the phobias, for instance. If they've been bitten by a dog, for instance, they may have a fear of dogs and so forth. But those types of fears tend to sort of resolve with time. but the more incessant fears tend to stay. ADHD is a huge problem. I think many times it is underdiagnosed. It is a controversial disorder, and it is one disorder that causes a lot of private pain and suffering. And I have a particular slide that will address these issues. But these are children who sometimes, if they're not treated, have problems all through school, academically, and they fail, even though they are of normal intelligence, smart kids, they fail in their ability to succeed in life. Another big area where ADHD rears its ugly head is test taking. Many times in the tests that our children, examinations that our children take, or even when we have to take, they're multiple choice. And the problem with multiple choice tests is the fact that the correct answer is not always the correct answer. The correct answer is the best answer, and that can be tricky. So if you have an ADHD child who's going through the list of options, you know, remember, he's not looking for A, B, C, D, or E, maybe A and C, B and D, D only, or all the above. And so sometimes kids with ADHD have a problem with that. Autism spectrum, this usually occurs very young in age, and it is a disorder where early intervention is very important. The sooner it is diagnosed, the sooner they get treatment, the better the outcomes. Eating disorders, rare, but does happen. And unfortunately, it's frequently associated with depression as well. And it's unfortunately difficult to treat. In their most severe forms, these children, these individuals have a really difficult problem. It's associated with body image issues, depression, and can be rather difficult to treat. Moving on to depression and other mood disorders, we've already talked about some of the signs and symptoms to watch, but mainly it is a persistent feelings of sadness and loss of interest that disrupts the child's ability to function normally in various settings, in the school setting, in the home setting, and when he or she is with their peers. Also, the bottom line of the depression and mood, sometimes adolescents act out their depression. So when they're engaged in risky behavior, using drugs, becoming promiscuous or whatever, or engaged in unsafe or unguarded behaviors, that could be because of an underlying depression. And PTSD, we've already talked about PTSD, especially in children who have suffered sexual trauma, or children who have experienced an event that is above the normal, say violence, or seeing someone get shot or something like that, or seeing someone get attacked and killed. Usually, unfortunately, it has long-lasting consequences. And finally, schizophrenia, that's a thought disorder. It sometimes frequently can occur starting in the teenage years. And unfortunately with schizophrenia, it's generally an imbalance, something going on in the brain, not so much caused by the environment. And the general thinking is the earlier onset of schizophrenia or a thought disorder, unfortunately, the worse of the outcome. So again, important to diagnose it early and to get it treated as soon as possible. So moving on, and we're talking about myths here. Number one, a child with a psychiatric disorder is damaged for life. That is absolutely not true. A lot of the psychiatric disorders that we have that we have now, that we talk about, ADHD and depression, are very treatable with the right kind of treatment, medication, and therapy. They can actually do very well and function very well and succeed in life. Myth number 2, psychiatric problems result from personal weakness. That is also not true. And I think a good example with that is, you know, in Asia, as you know, tutoring, private tuition is very common. For a child who may not be doing very well in school, they're sent by their parents to see a tutor. The parents pay extra money for tutoring, for their child to be tutored. And when it may be because they're not doing well because of an underlying mental illness like ADHD. So in the end, private tuition becomes a booming business in Asia, like in Singapore and Hong Kong, and in Korea and places like that, when really it could be that the child is suffering from an attentional problem and can't focus. Myth number 3, psychiatric disorders resulting from bad parenting. Well, there's no psychiatric disorder that specifically results from bad parenting or is caused by bad parenting. Bad parenting contributes to the problem, but it's not a causative factor. Myth number 4, one can manage a psychiatric disorder with willpower. Okay, well, you will find that, take ADHD for instance. In ADHD, the treatment for ADHD is medication. That is the best way. And you will find that if you look up the recommendation for treatment of ADHD by professional bodies like the American Pediatric Association or the American Academy of Child and Adolescent Psychiatry, these big professional bodies will all tell you medication is the way to go. So once you have a correct diagnosis and you treat that child's chances of succeeding in life is so much greater. I don't know whether you are aware, but if you were to go to any prison in the US and study the incarcerated population, you will find that it may be as high as 50% of inmates in a prison may have ADHD. It is that high, and many times it's because of their inability to succeed academically in school. If they come from a socioeconomic socioeconomic background that is not supportive of education, those are the children that are more likely to fall out of school at a younger age, withdraw from school at a younger age, and then don't have the backing of education and turn a life to crime. So that's a big deal. Myth number 5, it's just a phase. If we ignore it, it will go away. Well, it will not. And it's a little bit like sweeping dirt under the carpet. You know, if you sweeping your living room and you don't have a dustpan and you just pull the rug up and you sweep the dirt, you can only take so much dirt in there under that carpet. Myth number 6, therapy for kids is a waste of time and money. You know, that is something you have to consider. It's definitely not the case. Now, to be fair, therapy sometimes, the quality of therapy does range does have a big range. And generally, I would say it is the therapists who have worked as therapists for many years. Those are the best. Like Mrs. Lily Lam or Mrs. Tina C here, they have been seeing cases for years and years, and those are the ones that can be the most helpful. You know, it's the same with everything else. If you need a legal representation, a lawyer that has a lot of experience, that's the one you want to see. If you need shoulder surgery or knee surgery, it is those orthopedic surgeons who do 3 or 4 knee replacements a day. They are the kinds you want to go to. You know, number 7, children are over-medicated. Unfortunately, the way parents look at medication differs a lot. In the US, American parents are very familiar with popping pills. So they are less reserved, they are less hesitant, they are less reluctant, but not so in Asia. Many times I have seen and I have spoken to a lot of Asian parents with children with ADHD, even though they know the child has ADHD, and even though they know that the medication helps, they're so reluctant. But at the same time, certain conditions, these medications are like miracle pills. They help so much. So you have to get over this fear of medication and give it a chance so that your child can do better and succeed in life. And finally, the eighth myth here, children grow out of mental health problems. That is also not true. There is a certain percentage that they do things minimize with time and it looks like they grow out. But then there's an equal amount who their problems actually might worsen without treatment. So this is a slide that talks about the effects and consequences of untreated mental illness in children and teenagers. And specifically when I wrote this slide, it was again for ADHD. It is a private pain because many times people don't realize this. If you go to Asia now, there's still a very large percentage of people who have never heard of ADHD. They may have heard of hyperactive kids or kids who can't focus or concentrate, but some of them don't even know about ADHD. And for some sufferers, it's something they are uncomfortable in telling people about, and it's this sort of private pain that they harbor for many years. As I mentioned, it can be controversial and frequently misunderstood, and that's true for mental illness in general. And of course, the stigma, of mental illness, having a mental illness can be so difficult to deal with, especially in Asian cultures and that sort of thing. And also, a lot of children who have ADHD and were never treated, there's a percentage who just with sheer determination make it through, but there's some who did not, and some have been left by the wayside, or they've not been able to reach their potential and have had unfulfilled dreams for their lives because of ADHD. So that's why I say it needs to be identified early, and the earlier it's treated, the better the outcome. Academic challenges, we've already talked about test taking and things like that in ADHD, in depression as well. Remember, these illnesses all just make things worse all around. Relationship issues and social deficits. I remember once talking to a mother. This was a whole family that had ADHD. The son had ADHD, the mother herself had ADHD, and the father had ADHD. And the mother told me a story where she once sent the father to the grocery store with a list of 7 items to buy. The father goes to the grocery store, he buys 7 items, and he brings them home. None of those 7 items were on the list. So they're not able to focus. They are impulsive. They do the wrong things, and it can be a big strain on marriage. Then the discrepancy between intelligence and academic dysfunction. You'll find that many times, they'll say, boy, this child was really smart. We don't know why he did so poorly in school. Could be because of mental illness, could be because of ADHD, could be because of an underlying depression. And because of all these challenges, these are individuals who end up with a low self-esteem, a lack of self-confidence. They don't have that ability to, push on, and they give up, unfortunately. And then I've added the shame and loss of faith. That's always a big case with us Asians, and especially in the Chinese culture. That 面子 kind of an issue always rears its ugly head. And then finally, Similar to, as I said before, unfulfilled dreams is the limitation of attaining success in life. Many times someone may say, you know, I could have been good in something, I could have gone, but I didn't go that far just because I just couldn't study, you know, that kind of thing. So in summary, just hang in there, we're almost to the end here. In summary, signs and symptoms to look for. 1, a persistent sadness, 2 or more weeks, and sometimes a lot longer. Withdrawing from or avoiding social interactions. These are patients, these are kids who withdraw and become isolative. They spend a lot of time in their room, don't do anything. Repeated refusal to take part in normal activities. Number 3, hurting oneself, self-mutilated behaviors, self-injurious behaviors, including suicidal thoughts. Extreme outbursts or irritability that are beyond the norm and can be out of control. Big changes in mood and behavior and personality. Persistent disobedience, arguing or being aggressive. Changes in eating habits. Obviously, either a loss of weight is no good. Too much gain of weight is also no good. Difficulty sleeping. And the sleep issue actually can be divided into difficulty going to sleep, which we call early insomnia, waking up in the middle of the night and not being able to go to sleep. By the way, because of the sleep cycles, we actually all, in the course of our sleep, wake up about 3-4 times during our sleep. But it is when we wake up and then can't go back to sleep, when a child wakes up, can't go back to sleep, that becomes a problem. That's called middle insomnia. And sometimes you have early morning awakening where they wake up very early in the morning and they can't go back to sleep. Nightmares. Nightmares frequently are an issue of children who have suffered PTSD, post-traumatic stress disorder. And then the somatic complaints, in other words, physical complaints like headaches, stomach aches, those types of things can sometimes be related back to depression and other issues. Difficulty concentrating and focusing, we've already talked about that. That would be ADHD. Changes in academic performance, poor grades despite strong efforts. Actually, I can tell you grades and academic performance are wonderful indicators of where a child might be in terms of mental illness. Avoiding or missing school, that's another one. Okay, so whenever you have concerns where they just don't add up, problems don't add up, the big recommendation is to refer to a healthcare professional. You can see a therapist initially, and if he or she believes that there is a stronger mental illness in your child, then go seek a psychiatric evaluation. Now, this is what I would do when I see someone for an initial psychiatric evaluation. Generally, I won't do a full medical exam, but I will ask a strong medical history. Is there this? Is there that? I will ask for a strong history, a good history of either physical or emotional trauma, what stresses there might be, family history, as I mentioned before. A lot of the conditions that we talk about have heavy genetic loading. And then I would review symptoms. Is there anxiety? Is there depression? Is there psychosis? Are they hearing voices, seeing things, that kind of thing? And then a timeline. Frequently, when you do a timeline, you're able to sort of see where things started to go wrong in your child's life. As I mentioned before, academic history is a big one. Interviewing parents, get their perspective. Conversations with and observations of the child. By the way, interview with parents is one thing. Sometimes there might be a need to interview the teachers as well. That may be an issue. And then there are a lot of these standardized assessments. Sometimes we use them, and these are useful for parents, especially parents who may not know what the symptoms are. And these are frequently ready available on the internet for you to pick and download and print. Finally, the do's and don'ts of mental illness. Don't ignore signs and symptoms. Don't be afraid of your child. You are the parent. Do seek help from someone who can help. That may be the most important one. Let the experts make the diagnosis. Don't self-diagnose. Don't expect instant gratification. These things will take time. It's just like dieting. You know, we're not going to lose weight in a day, though I know there are commercials on TV that claim those types of things. It will take time. It also takes time to get an appointment, unfortunately. The treatment process is not instantaneous or not immediate. Don't wait until there is a major crisis before seeking help. Don't wait until it's too late. Again, with ADHD, as I said, frequently if I have a high school student or a college student that wants help with ADHD, we can still help them, but in some ways it's a little bit late. Don't be afraid of medication. We've talked about that before. Don't give up on treatment recommendations just because you think things seem better. The most successful treatment can be a combination of treatment options: family, individual, or group therapy with a psychologist or a therapist, and medication prescribed by a medical doctor, like a child psychiatrist or a behavioral pediatrician. You know, this is a little bit like cancer. If I have cancer and I go to MD Anderson, they might use radiation therapy to shrink the tumor. Then they use surgery to remove the tumor. Then they use chemotherapy to make sure that all the cells that were not removed through surgery are killed, and to make sure that the cancer has not spread. So if you can use multiple forms of therapy in cancer, it would be the same thing in mental illness as well. When in doubt, ask and get help. Number one, better safe than sorry. 2, seek professional help and evaluation. Number 3, frequently it is a communication issue. Number 4, encourage and facilitate discussion and expression in your child. And number 5, spend time with your child. We've talked about struggles. We've talked about struggles, but we're in the real world. This is our life. This is our life on earth. We are a sinful people, but then we have the Lord behind us. We have a loving and caring Heavenly Father who wants us to be dependent on Him, who wants us to seek Him, and many times He will help us. Remember, Romans 8:28, all things work out for the good to those who love Him. And this is a quote from my father, my late father, who was a very good and loving father. He had his faults. He was not perfect, but he would always say, Dan, our struggles make us stronger. And I believe it's true. And out of the cracks of life, out of the crevices of life, out of the dirt of life, if we take steps to help us and seek the Lord, we will see something new come out of this. And finally, I want to end with 1 Thessalonians 5:16-18. Rejoice always, no matter what. Pray continually, no matter what. Give thanks in all circumstances, for this is God's will for you in Christ Jesus. Thank you.
Well, we really appreciate Dr. Daniel Tan give us such a